If we fail to provide appropriate healthcare information and healthcare services to any group in our society, it affects all of us. It affects our costs of healthcare. It affects the quality of the workforce in our country. It affects the future of our children. So what you ought to want is first-class healthcare for everybody. And if it requires different strategies for different groups, that's the only way we can get to first-class health care for everybody. We ought to do that. But it also tells us that we have a much more sophisticated understanding of different groups in our society, what they eat, what their health care outcomes are, if we're going to have first-class care. It cannot be homogenized.
That's an interesting
point. It doesn't work if you want to get to health care quality. You have to have cultural sensitivity. In my own community, the Arab community, new immigrant women do not want to go to male doctors. I'm an Arab American, and therefore healthcare has to be organized differently.
What kind of successes have you had there with the culture diversity?
Well, first of all, we've learned a lot that language alone will help. And number two, knowing something about cultures means that we can use different approaches for different groups. Different outreach approaches, different follow-up approaches, and that we will get better quality because of that. More importantly, we'll coax more people into the healthcare system. That's the importance of not simply training people in different backgrounds, but making sure that they understand what these differences are. Every young person that goes into medicine or into nursing today ought to want to do the best they possibly can. If to do that, they have to understand culture and history and race, then it's important that we do that as an integrated part of their training.